Hey, great. Thanks, Ron. So the agenda, I'm going to, I'll have Jesse introduce himself in just a second. I'm going to give a bit of a background on OutSystems and low code, and then I'm going to turn it over to Jesse to talk about the challenges and what the US Acute Care has done. Just from an introduction, since I got the floor, I'll introduce myself first. I'm Tony Olivier, a product marketing manager here at OutSystems. I live and breathe in Canada, in Vancouver on the West Coast. But I've had a career with Microsoft, IBM, Apple. So I've been around the world that way. Jesse, I'll just let you introduce yourself first.
Sure. Hi, everyone. Jesse Tarovich, VP of Technology at US Acute Care Solutions. Most of my expertise comes from application development, data warehousing, obviously now being more in general technology management, but we have a deep history with low-code development and some great success as of somewhat recent with OutSystems. So happy to talk about that with all of you.
Thanks, Jesse. So I'll introduce OutSystems. We're a global company headquartered in Boston. Development goes on in Lisbon, Portugal. Actually, was founded in Lisbon about 20 odd years ago, and our development is also in the US and India. We're sitting about 87 countries, lots of different industries. The thing that's really interesting is the amount of community members that we have. Almost 700,000 people that are using the OutSystems platform from a development point of view. I do want to go into low code. Looking at the titles of the audience that are on here, you've probably heard of low code. You may be using it, but I want to kind of give you a sense of what low code is, and I'm going to play this very short video.
This is OutSystems, the low-code platform that radically simplifies development, unleashes innovation, and creates high-performing teams of professional developers. Quickly develop web and mobile apps, chatbots, and portals for any device. Just drag and drop to design your data models, workflows, logic, and user interfaces, and even add your custom code. All inside the most advanced IDE built by developers for developers. Integrate any system and source of data and publish with a click. Low code, high performance. Let's go! This is...
Sorry. So what we just showed you, we have a visual development interface, and it's for programmers. It's not a citizen development platform. There's lots of citizen development platforms. There's about probably a couple hundred in the marketplace right now. It's specifically for professional developers to boost their productivity. Gartner, as one of the analysts that we work with, they have a low-code application platform Magic Quadrant called the LCAP. We are in the leaders. We've been leaders actually for about the last 9 versions of this. And we're also a leader in what's called the MXDP, which is Multi-Experience Development Platform. But I just wanted to give you a sense of, we're relatively a small company compared to somebody like Microsoft or Salesforce, but we're absolutely leaders in the space. Now, when you're building, so we're primarily for building custom software, right? We don't have existing solutions that you just sort of add water and stir. It's all about building custom software. Now, from a standard commodity point of view, if you need a CRM application in your business, you go, well, I'll use Salesforce or I'll use the Dynamics. If I'm going to use ITSM, I'll probably go ServiceNow, ERP, SAP, and so on. 10, 15, 20 years ago, or even longer, if you needed a CRM, you might have built one by traditional code, and then Salesforce really, came into power. Be able to really commoditize that. Now, what happens though, a lot of cases, the COTS application doesn't do exactly what you need to do, so you need to do some extensions. So there's a lot of low-code suppliers that actually do extensions on that. Now, we've also seen low-code around citizen development, right? When I worked at Microsoft, I worked with SharePoint quite a bit. In a lot of cases, customers and end users would use SharePoint to build specific applications. Prior to Microsoft, I was at Lotus on the Lotus development side of things. Jesse's going to talk a little bit about that. But Lotus Notes was very much a citizen development platform. If I needed to build an app, something and I couldn't wait for my traditional development shop to build it, I would build it out myself. That was both very good and very problematic as time went on. And then finally, but really you're stuck with from a, if I've got a custom application that doesn't quite fit, whether it's low code, doesn't quite fit a SaaS application, I'm going to use my developers. I'm going to get my team of developers in my favorite development language, and I'm going to build it out. The issue with that, of course, is that it takes longer, costs more, and you start to run into problems with technical debt. What I wanted to kind of position is that OutSystems, we fit across all those areas. We fit very well across covering the low code space, the SaaS space, and we do really well assisting and replacing the idea of traditional code and really helping developers do their development faster. And we kind of handle a lot of the mundane pieces with that. So what I mean by that is, if I take a look at the platform overview, we're a full we're a full stack platform. So we do the UI, we do the logic, and we do the data. So the visual, the commercial I showed you ahead of time, everything is done visually. So you build out your screens, you build out your logic, you build out your connections to data. That is all done with it, either native Windows or Macintosh a development environment. We, using the development environment, allows you to compose, and Gartner calls this a composable enterprise. We have essentially a set of open source components that you can pull together to create your applications, to connect to whatever system of record, whether it's a database or something like an SAP or Salesforce. Those are all included with the system. We have an open source a marketplace that is called the Forge, and there's about 4,000 plus components on there that are just available to drag and drop into your environment. We're a full life cycle, right? We don't just, we're not just executing at the user level. We're full DevOps life cycle. We'll integrate with your own DevOps system. We do, development, test, production environments. We'll do all the CI/CD monitoring, the feedback, the governance. We'll manage all that for you. And we deliver the widest amount of touch points, the widest range of digital experiences. The key part of this is that if I build an application, so if I build, for example, I'll pick something, a travel authorization application. I have one code base, and I can deliver that on a web. I can deliver it on a progressive web app on mobile. I can deliver it as a native iOS or native Android, and I don't have to have separate development teams to be able to do that. We will generate that code for you automatically. And the last thing I want to talk about before I get into the kinds of apps is that we sit on the cloud of your choice. We have our own cloud based on top of AWS, but we also run on Azure. We run on GCP. I run on private data centers. You've got a lot of flexibility with that. And the last thing I'll talk about is we actually generate code, right? We're not interpreted. We're not running somewhere else. We actually, as we go through and you build out you build out your application visually, we actually generate the C#, the SQL statements, the HTML, the JavaScript, everything you need, so that can be actually scanned by third parties if you need to, or we do a couple hundred different security checks going forward. Now, the kinds of applications that customers build with OutSystems, again, we've been doing this for around 20 years, has kind of gone into three different areas. You see a lot of customers building customer-facing portals and applications, whether customers or partners, those kinds of things. We see a lot of customers building internal business applications. This is sort of operational efficiency kind of apps. And then we also have a number of customers that have replaced or augmented their core systems with OutSystems. So if we look around the healthcare value chain, so we see a lot of things around patient and members side of things, medical staff in sort of internal aspect, beyond the hospital around supplier self-service, procurement, sourcing, and then again, hospital operations. We have some organizations, and I've got a next slide coming up, that they've actually replaced their main Cerner, for example, with OutSystems because of the complexities of doing traditional code. I'm not going to go too deep, but this is just a slide showing separated into customer apps or customer portals, internal business, and core systems, the kinds of range of applications and the types of applications and use cases that we've seen. So we have Jesse's going to talk about US Acute Care. We have Seattle Children's. We have Medtronic doing remote monitoring of their heart device, Humana around Asian Portal, and so on. So there's a variety of use cases that our healthcare customers have been using OutSystems for. And again, from core systems, customers tend not to start with a core systems, but we found a lot of organizations are looking once they've started and they've built out a portal, that they start to look at, my ERP system's not doing exactly what I need to do. Do I need to replace it, or can I build it out in something else? And we've seen that happen again and again. Okay, I just want to turn it over now to Jesse.
Thank you, Ron. So a little bit more about USACS. We are today the largest physician-owned provider of integrated acute care medicine. Acute care, as we mentioned earlier, is not just emergency medicine, but other specialties like hospitalist and observation medicine. And then we're aligned with a lot of the leading hospital systems across our country. So today we have over 500 locations. We're treating over 9 million patients a year across 28 states. One interesting note about US Acute Care Solutions is from a clinical treatment perspective, we use the systems at the hospital. So the way our model works are the clinicians work for USACS. We have roughly 7,000 clinicians, and we contract those out to these locations, and the clinicians use the systems of the hospital. But you can imagine with this size of a business, there's a lot of technology around just running the operations of the business, HR, legal, compliance, analytics, and of course our revenue cycle. So for all the patients we see, we do the medical billing as well. So going back to 2015, that's when the journey with OutSystems started. We were seeing some symptoms that, to keep in the healthcare realm here needed treated. We had a legacy clinician portal. We've always wanted and always had for a long time a one-stop shop for our clinicians. They're out in the field, they're using all the hospital's different systems, but when they have to work with the company they work for, we didn't want them to have to go to 3, 4, 5 different applications, have multiple logins. We wanted a one-stop shop for them. And so at the time, before 2015, we had built a clinician portal on a legacy platform that at the time was great, but it wasn't keeping up with the technology. It was becoming hard to deploy changes that were compatible across browsers. We had additional functionality we had to layer on to build mobile apps, for example. And so it was really becoming much more difficult to meet our business needs and to flex and change with our industry that was changing all the time. And so, we set out on a journey to look at other low-code platforms. Going into it, though, with a lot of experience in low-code. So, as Tony mentioned, we had been users of Lotus Notes at one time. We had been users of a product called Vignette that was bought by OpenText. And so we knew a lot what we wanted, what to look for. And so through that, we found OpenText. We found OutSystems. Still have OpenText somewhere in my brain that is being resurfaced. But one of the key differentiators with OutSystems that we wanted from our other prior solutions was ownership. And what I mean by that is we didn't want to pay us a fee to just keep our application up and accessible. We didn't want somebody to own the data, own our IP. And with the way OutSystems is structured, with it not having a proprietary runtime, like Tony mentioned, it runs through .NET. That was a big differentiator. Out of the box, having DevOps with the dev and the QA and the production environments to really speed up the development, and having it run on-prem, that gave us the level of ownership that we were looking for, especially when it comes to low code. We decided a long time ago when we made the decision to go low code is we're not a technology company. It just didn't make sense for us to hire and staff and manage, teams of different specialties that are required to build scalable, efficient apps like, your programmers, your data architects, your graphic UI designers. And so really with low code, it gives us, it takes us level up when it comes to delivering apps, and it allows us to do it at a very productive, efficient process that we've had considerable success with. And so, of course, we treated our issue with a new portal, next generation portal, that had many dynamic capabilities. And so we were able to do not only deliver the apps to the users, but OutSystems has some nice back-end asynchronous processes that you can run for integrations and other aspects of your apps. It allows you to build modules that you can then reuse for other applications. So build once, use many times, which was great. Of course, it's secure and compliant. That was a must being in healthcare. We also wanted something that not just could deliver this portal, but that it could also replace a lot of our legacy apps and put everything onto one platform to simplify our architecture, but also make it easier for our users. We didn't have to go to different systems. And so, of course, one of those legacy apps was also Lotus Notes. So all of those databases that we had, we either decommissioned them or moved them over to OutSystems. And through all that, we're deploying much faster on a comprehensive system that does it all for us. And so, as a result, it was easy. The ROI was easy in this case. When you factor all the legacy software you're running, the inefficiencies of that, dollars start to add up pretty quickly. And through just the savings with the legacy apps, through some process improvements, especially related to some of our RCM systems, we achieved some ROI pretty quickly. It has to be SOC 2 and HIPAA compliant in our environment, which it is. We were able to deliver very quickly. So for the first project to deliver our portal, we delivered it in 5 months, which is very telling because the portal prior that we were replacing had 8 years of maturity that we were building in 5 months in this new app. And so I think that really speaks to how quickly you can get up and running and develop in OutSystems. Of course, we had great feedback from our clinicians. The agility of it to be able to make changes, to respond to their feedback with actual results and show them, some changes as a result of their feedback, I think, really got the buy-in quickly, and it's helped propelled us with some additional successes. In terms of resources, the nice thing is we have scaled the footprint of OutSystems across our organization at least 4x from where we started in 2015, and we've only added 2 resources to the team. And so that has been really big for us to be able to say to the organization that we have a system that we can not just deliver what we initially set out for, but we can achieve much more beyond that with costs that are much more efficient than any of the other costs we've seen with other solutions we've been using. So as we continue now in our journey, we've shifted our strategy from migrating legacy apps, which those still exist because we still do a lot of mergers and acquisitions. With those come a lot of legacy systems and apps that we have to move on. So we still do that. But with all that success, we've also shifted to a strategy of vertical integration. So we have achieved integrating other applications on the OutSystems platform, like a CRM application that has replaced Salesforce, a compliance case management system for our compliance department, and also a patient survey application. So that's really helped us. 2 main drivers is obviously cost, but also control. Wanting to have control over these solutions, because a lot of these off-the-shelf applications you buy sometimes, they can get you 80% of the way you maybe want to be or where you want to go, but that 20% lingers out there and can be pretty significant over time.
Hey, Jesse, I just have a question about that. What was kind of the driver for replacing Salesforce? I'm assuming that if you went to your management and went, "Hey, we're going to replace Salesforce," they kind of what? Because of the name and how all over the place it is. What was the story?
Yes, it's an interesting one. That came about during COVID. So as most people in healthcare, overnight, our volume was cut in half. People weren't coming to hospitals. And so we were able to take a look across our applications. And so this is one of those scenarios where I say, don't let a crisis go to waste. We were able to look across our systems and say, which ones are are offering us the most ROI. And if they're not offering ROI, these are the times where we need to really look at them and say, are they really important? Are they needed for the organization? And so when we looked at Salesforce, very costly. We've had challenges with trying to scale it to more users because of the cost. The benefits we were getting out of it, were somewhat limited because there was a lot of customization that was done to it that hadn't been yielding the benefits that it was supposed to. There was difficulty integrating with some of our other enterprise applications. And so the decision there was to then build it into OutSystems so that we can better custom build what it is the organization needed and wanted that they weren't getting out of Salesforce, and then to more cost efficiently scale it to, instead of 50 users, scale it to thousands of users.
So what was the approximate sort of time frame to deliver that?
That was a 6-month project.
Okay.
Yeah.
That's probably the same amount of time if you were to buy Salesforce and then customize it to fit your needs, right? In most cases, as you said, the customization's fairly elaborate. And what about the compliance? Maybe talk about sort of what that kind of looked like.
Sure. So this I put in the category of one of those niche applications, where we had a small vendor that was delivering an application for us, but it was missing that 20% that our compliance department really needed. The vendor couldn't deliver on, a couple of key pieces of functionality that they needed. And at the end of the day, even with Salesforce, these apps are not, when you boil it down, aren't that difficult, especially when they're not, when they don't have complex interfaces, when they're really just data-driven forms with some, relational database on the back end. It's not that complex if you can get the requirements right up front. The one interesting thing about going to low code and going to OutSystems is there's less focus on the actual programming and development and the deep technical piece of the project. There's a lot more focus on the business analyst side of it. And so we've invested with some great business analysts that sit in front of our application development team that interface with our business users that can really document and identify what it is they need from an app and put all those requirements into something that our developers can then build within OutSystems. That is a key to success for delivering on OutSystems that we've been very successful with. And so just sitting down with our business analysts, sitting down with our compliance team, for example, who are not technology people, to sit there and look at what they have today and talk about what they need and to put those into documents. Once you have a process for that, it's really not that difficult. And I think it will be interesting, sort of opinion on my part, but a lot of these niche app vendors that have these niche apps with low code now, and especially OutSystems being able to deliver these apps much more easily, I think those use cases are going to become much more compelling to build internally using a system like OutSystems.
I've seen that other customers they've actually said that normally the users create the requirements, give it to development, then the users wait for the stakeholders wait for the development to come back, and we found that the developers are so fast, the developers are now waiting for the new business requirements, right? Which kind of shifts the model. The last thing I'm thinking like a patient survey, right? I filled out a Google survey today. Why would you not? What drove you to use OutSystems versus something that I'm assuming you had off the shelf, or that's something available off the shelf?
Sure, that was again, drivers, cost and ownership. So cost, had a very pricey vendor doing this for us, so that was an advantage to bringing this in internally. And then 2, ownership. We had limited abilities to customize the application. And so, for example, when we were rolling this out to our hospital partners, we originally went with the patient experience strategy. Let's try to capture data around the patient experience and understand how things are going at the hospital and how their treatment was, challenges, opportunities. And so as we were rolling out to our hospitals, we were getting a lot of feedback like, hey, been there doing that. We have a patient experience tool. What we want is someone to follow up our patients and make sure they're recovering okay. And so by having this in our system, by building this on our own, by owning it, we were able to quickly pivot and build in follow-up capabilities where a patient could we can ask them a question. Do you want somebody to contact you? They can click yes, and then we can build a queue. We can build a workflow within our OutSystems app so that our clinicians can then respond to those requests by the patients. And so something like that, for a commercial vendor, would have been very costly for them to do, and would have taken them much longer to build that into their product, which they're not building just for us, they're building that for many other customers. And so by having that ownership, we were able to better meet what our clients are asking for, and ultimately to help care for patients.
Yeah. Oh, that's a great story.
Hey, this is Ron. I'm just want to speak for Chris, who runs all the labs for Sanofi. Chris, I'm going to allow you to speak, and hopefully you can ask your question about how OutSystems and the applications it enables can be integrated either with the public cloud like AWS or the public EMR clouds like Epic or GE Healthcare. Chris, can you ask your question if I didn't do it correctly?
Sure. As you can probably imagine, most companies have more than just one provider, right? So they may have some on-prem, and then they've got, whoever the cloud provider of the day decides to offer us the best price, right? And the support model appropriately with the right components. So here at Sanofi, we always want to be conscious of that from a cost perspective to say, we may have some stuff running in one, but what if we wanted to move it somewhere else for portability reasons, or because maybe we've got folks in another region that need it, and they maybe, they're not using that particular provider, or they're looking to go to someone else. So I just wanted to know from an agnostic standpoint, is it portable? It sounds like Tony had answered my question, but yeah, it's nice to know that there's options there.
Yeah, thanks for the question, Chris. So our native cloud, so the OutSystems cloud, we run it on AWS, and what that means is we take care of all the maintenance of the servers and the databases and those kinds of things. So sort of less work for you. But we also we basically hand you the platform, and we've done some work on it, but you can deploy it on Azure, you can deploy it on GCP. We've got customers that are deploying on their own private data center because they want to see the data, running locally. That's all available, and then you can move the applications, between the environments.
Okay, thank you.
Any other questions, Ron?
Chris, maybe you could talk a little bit, maybe this is better for Jesse, on how easy it is to integrate OutSystems powered applications with not just the AWS or Azure public clouds, but more the Epics, the GE Healthcare EMR cloud.
Yeah, it's been for interfacing. We have dozens of interfaces with our OutSystems platform. The nice piece about it, I mentioned a little bit earlier, is that there's a back-end process component to OutSystems where you can build processes that run independently, and through that, you can interface, any REST-based APIs, FTP servers. So moving data back and forth is extremely easy with OutSystems. There hasn't been an API that we haven't been able to interface with. Another one is Twilio for the text messaging for our patient surveys. Interfacing has been one of the strong points and one of the easiest points to work with OutSystems.
Well, I'm not sure if you have any other questions. I can tell you that was a fascinating case study to illustrate just the power of OutSystems. I'm listening to Jesse, and let me make sure I got this right. So it works better, it's easier to update, I get faster new developments in place, I've got all the same compatibility with all the existing healthcare specific clouds, I'm saving money, I'm more secure, I'm rolling it out faster. You buy a new company, it's easy to tie it together. You're in a new facility, it's easier to make it happen. It's like having your cake and eating it too.
It's an easy decision, that's for sure. So yeah, you got it right, Ron. Thank you.